What is a journey? It is not just traveling from one place to another. It is the things we learn, the experiences we have, the struggles we face, and how we develop as individuals. My journey through chronic kidney disease and end-stage renal failure encompasses all of the above. This is my story, from diagnosis to transplant. So let's get in position. Still in Richmond. I worked for Sprint at the time. However, they gave us an option. They said, okay, if you decide to stay with the company and move to Atlanta, staying on the East Coast, we'll pay for everything. You don't have to worry about anything. You still have a job. If not, you gotta look for a new job. So of course, it's like, all right, I want to keep my job. And so we wind up moving to Atlanta. So let's fast forward from 2000 to 2003. Now, understand, I have to find a new nephrologist. This particular nephrologist kept coming up as far as my area where we live today. They kept coming up number one. We read the reviews, read about them, looked at some others, and whenever we would do some more research, they kept popping up, right? And so it was like, okay, let's give them a call, let's set an appointment, let's go, right? So we go, or I go. It went very, very well. And this little, I don't even know if she was 5'1" or if that. She's very, very short Indian descent woman, comes out with this high-pitched voice with the biggest smile ever, as though she was waiting on me to meet me. That, wow. And it's Dr. Kumar. She comes out, she shakes my hand, she introduces herself. She welcomes me to the office, and I just got the warm and fuzzies when I met her. And she explained to me what she does. She wanted to do more testing so she could get, where I was present day, which was good. And so we met. She had a real high-pitched voice, but just the warmest smile, and her presence was really, really warm. And so she orders more tests, blood work, lab work that I had to do so she can make sure that she's in the right place, or how to, pick up from the last nephrologist who was treating me in Richmond, Virginia. And so after that visit, I felt okay. Still had some reservations though. Didn't know what to expect. I probably was probably here. My level of comfortability was probably around right here, right? Because I didn't know what to expect. And so I had another appointment with the primary care physician, right? And so prior to seeing him, this particular doctor, he wanted to do lab work, which was fine. I understood. I'm a new patient. He wants to know where to pick up from and so on and so forth. Same thing as the nephrologist. And so I go to that doctor's appointment, and he's reading my chart and he's reading my blood work results. So he says, Craig, I'm looking at your blood work here, and your creatinine levels are high, and I sense that there are some issues with your kidneys, And I think we really need to address that. And so I said, well, I can't remember his name because we changed a long time ago since him. I think he retired or something like that. And I'm just looking at him and I'm saying, yes, yes, doc, I know. I already know. This happened in Richmond. I was diagnosed back in 2000. And he says, so you're aware of it. I'm like, yes, yes, sir. I'm aware of it. Yes, yes. He said, okay, great, good. And you're on top of it. Do you have a nephrologist? I say, yes. Matter of fact, yes, I have a nephrologist. I get to see her next month. I have to see her next month. And he said, okay, great, interesting. Who is your nephrologist? And I said, it is Dr. Kumar. He said, who? I said, Dr. Kumar. He said, Dr. Kumar? I said, yeah. So I'm looking like, whoa, oh man, do I have the right person? Come on. No, 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 don't tell me. This is going on in my mind, right? So he looks at me, he takes a seat, right? He sits down, he pulls up, because they had those little stools on wheels. He pulls up the stool and he sits down and he crosses his leg and he folds his arm and he says, Craig, if Dr. Kumar is your nephrologist, you have one of the best nephrologists in the state of Georgia. I'm like, I do? He says, yes. He says, listen to me. He said, whatever you do, never come from under her care. He's pointing at me. He's getting close to me. He's pointing at me. And he's saying, whatever you do, this has never happened to me ever in my life. He says, whatever you do, never come from under her care. I said, really? Is she that good? He says, listen, let me tell you. He says, now I don't know her personally. However, Dr. Kumar's patients rarely have to go on dialysis. I said, wow. Are you serious? He said, yes, she's that good. He said, man, I'm happy for you. That's what he said. He said, I'm happy for you. He said, good. That's good to know. That is really good to know that you are in great hands. You have the best of care. She will take great care of you. She will take good care of you. And so, like I was telling y'all, my level of comfortability was here. After that, it shot through the roof. I mean, I was so happy and relieved. I was relieved because, number one, he said he didn't know her personally. Now, it'd be a different story if they was buddies and that was his girl, you know what I'm saying? So, and also too, he's not in that profession. He's not in nephrology. He's not. And I'm pretty sure he sees a lot of her patients, right? So he knows and he follows the trends. So that right there took my level of comfortability through the roof. I'm telling you. Moving forward with Dr. Kumar, this woman, this little she, little 5 foot woman. I gave her the benefit of the doubt of saying 5'2" or whatever. She was shorter than that. Tiny woman with a high pitched voice. I'm not making fun of her, but she would always see me, and when I have a appointment with her, this she, oh Craig, how are you today? Oh, it's so good to see you. Oh man, she was so funny. She was so cute. And this woman, but she was, I'm gonna tell you, she was a bulldog when it came to your health and taking care of business. She was on it. She was on top of it. This woman made it an point to become my healthcare or nephrologist professor. I have to say it that way because she made sure that, because every time before an appointment, I would have to do labs. I would have to do blood work, labs, and I would have to do like what they call a 24-hour urine, right? And they would test it and see how much protein I'm spilling, if I'm doing the right things, checking my blood for my creatinine levels, where they are, my EGFR calculations, and so on and so forth, all of that. And this woman made it an point that I know and learn how to read my lab results. She didn't want me to just come in and listen to her and just take what she says. She made it an point. Every time we would sit down, she would put the lab results in front of me. She would face it my way. She wasn't reading it because she already read it. She already knew what it was. And she would point to it and say, okay, Craig, this is this. What this means is this. And then she would go further on, and then she would back up and see if I was listening. She says, okay, what is this? And I'm like, you said that was my potassium. No, Craig, no. I'm serious. That was every visit. So I had to straighten up and fly right because she wasn't having it. She was not having it. But every visit, every 3 months, I was in nephrology school. I was there with her. She was my professor, Professor Dr. Kumar. On the flip side, every time we would come in, before we would go over that or start the lesson, we would get to know one another. She would ask me, what did I do for a living? She would ask, how many children do you have? Do you have children? Are you married? She would ask about me, be concerned about me. And I, in turn, would ask about her. And she would be open. She would tell me how many children her and her husband had. And she was actually, I remember that she was excited because her daughter was getting married. That happened. And then after that, her daughter was expecting their first child. However, they found out it was twins. They was having two. So she was very, very, very excited about that. So we became very, very close. She almost, I used to call her Auntie Uma. She was like that. Every time I come home and my wife asks me, what happened? What happened today? How'd it go today? what did Auntie Uma say? She was so cool like that. She knew when I fell off because I had my days. I had my days when I just ate what I wanted to eat. I think we all have that. And she would get on me every time. Every time she would get on me because she could read it in the numbers. The numbers told it all. And so now, fast forward some time or a year or two, I'm learning, I'm paying attention to what my numbers are. So I'm really anxious to get the results to see where I am, if there's any improvement, because some people are known to go not advancing stage, because there's 5 stages with chronic kidney disease, CKD. I came in on a stage 3, and some people do well that their kidneys actually do the reverse. They go from a 3 down to a 2. However, in my case, because of the damage, and we already talked about that, because of the scarring of my kidneys, there was no repairing them. The other thing that Dr. Kumar did, and I'm so grateful that she did it, she prepared me for the inevitable. She always would tell me, now, Craig, because of the FSGS, remember we went over that? Because of the FSGS and the scarring of your kidney tissue, and there's no repairing it, as you get older, as you age, the disease will worsen. And so, Craig, dialysis is inevitable for you. That's what she told me. She kept telling me. She kept preparing my mind. That's how awesome she was. She would keep telling me, so there wouldn't be a shock or a surprise to anything when it was time. She would always tell me that. And now I'm to the point where I understand what creatinine is and what the range is and where I should be. I understand what the BUN is and the EGFR, and I know what those things are. So now when I come into the office, this is what she does. When she comes in the room, she greets me with that big, huge smile that lights up the room. And she has the lab papers in her hand, and she throws them on the desk, and she says, "Read them to me." The first time she did it, I thought she was joking. She wasn't joking. I told you this woman was a bulldog, right? But it was all in love. She threw it on the desk, on the table. "Okay, Craig, read them to me. Read your results back to me." And I would have to sit there and read it back to her. And some things I would still have an issue with, but thus far I could read and I could say, well, this, because what they would do is they would have my last labs from my last visit side by side with what's current. And so I could compare if I increase, if they stayed the same, if it decreased, if it got better, whatever. So I would go down the list and read it, and I would check with her. I'd be like, my creatinine is such and such, and from last time, that didn't change. That's good, right? That's good, right, Dr. Kumar? She said, "Yes, that's very good, Craig, very good." She would tell me that all the time. She would say that. And sometimes I would forget, and she would remind me, and then she would circle some things. Man, she was just awesome. She was just awesome. And, our visits, she made my visits really, really enjoyable, actually. I never had a bad visit with Dr. Kumar, never. And so she was just great. With her care, she kept me on a stage 3 for 18 years. 18 years. That primary care physician didn't lie not one bit. Not one bit. That woman kept me on a stage 3 for 18 years. Now, of course, it just wasn't her. I had to do what I needed to do too. So I had to buckle down and get disciplined about my own care and get serious about my own care. Yes, it was a fight. It was not easy at all. Certain days I struggled. Some individuals, like when you're going out or you visiting somebody at their home or something like that, and they're making dinner, and then you tell them, well, I can't have that, or no, thank you. You don't want no collard greens and stuff like that. You don't eat greens, boy, and you get stuff like that. But they didn't understand that I already knew, nutrition wise, what I could have and what I couldn't have. That was the other thing. She taught me what was in what, and what I needed to stay away from. And she got me to the point where I could look at a plate of food and I can tell you the contents of what's in each item on that plate. I remember one situation. I really wanted to get into this, where again, when I said Dr. Kumar was very, very excited about her daughter having twins and her grandbabies, right? And she was so excited. So by this time, her daughter has the twins, and I forget where her daughter lived. I don't think she was in Georgia at that time. And so she told me, because every time I have a visit with her, I would ask her, I said, how your grandbabies, how the twins? And she would be so excited to talk about them and so on and so forth. And so she was finally taking some vacation and going to visit them, right? And so I kind of forgot, because mind you, I don't see her every month. I see her every 3 months, like once a quarter. So time went on. I probably forgot when she went or something like that. And so my appointment comes up, because they send me reminders. The doctor's office send me reminders. And so I go to the office for my appointment, and the nurse at the desk, she says, well, Craig, Dr. Kumar is not here. I said, oh, that's right. So she went to go see her daughter. She was like, yeah. Would you like to see one of our other doctors? And she names the name. I won't say his name, but she names him, right? And I'm like, okay, cool. I seen him around here. He seemed pretty cool, right? And so I go to see him, and he reads everything, and he's like, okay, right? And he sets up a test, and I'm like, what? Why are you doing? Like in my mind, I'm like, why is he doing this? And so he sets up it's a sonogram, right, of my kidneys. He sets this up. This is not all in one day, but I'm just trying to condense everything for you. So he sets that up. He reads the results of that. He gets that. He does some other tests, and he says, he comes to me and he says, I want to try or put you on, I believe the medication's name was Prograf. I think it was Prograf, right? And he explains what it does, and he says, well, it's fairly new, and it helps to lower blood pressures and so on and so forth, and protect your kidneys. And I tell you, my inner man, inner spirit, let me say that. My inner spirit went bananas on the inside. It freaked out on the inside. And I heard it clearly. Do not take that. I heard it. Do not take it. So I took the medicine when I knew I shouldn't, or I wasn't supposed to. I started taking this medication. Time went on, and I'm having this funny feeling. I am urinating often. I'm going to the restroom often, right? Soon as I go, I come out, sit down. 2 minutes later, I gotta go again. What is all of this? Why is this happening? Then my eyesight goes out of whack overnight like that. I can't see. I cannot see. I wasn't wearing glasses at the time, but I could not see. I couldn't see. Everything was blurry. Everything was blurry. And so I immediately pick up the phone and I call the doctor's office and I talk to him. He says, yeah, Craig, what's going on? I said, man, I can't see. And I'm going to the restroom like every 2 minutes. He says, go to the emergency room immediately. I'm like, what this guy done did to me, man? What did he do? So my wife was right there. She said, what did he say? He said, I need to go to the emergency room immediately. I went to the emergency room because for some reason we don't live far from the hospital, which is good. That's a good thing too. And so go to the emergency room. They took my vitals. I told them what was going on with me. I didn't have shortness of breath or anything like that. I told them what was going on with me. They pricked my finger, took my blood sugar. And the lady said, all right, we're taking you to the back right now. I'm like, what's going on? What's happening? She said, your blood sugar levels are so high, we can't even read it. We're not getting a reading on it. It's so high, we're not getting a reading on it. We take you to the back right now immediately. And so we go to the back, and I'm like, of course, I have to go to the restroom. So I went to the restroom. All I know was I started feeling lightheaded, and I started stooping down, and I looked on the wall, and I saw that emergency pull in case of emergency string. I slumped over and I pulled the string. Next thing you know, I'm on the floor. I think I blacked out for like a minute or so, but I was still able to hear, and the nurses rushed in there. Thank God I was able to pull that. And I'm in a diabetic shock, close to a diabetic coma. And I have to stay in the hospital for about 2 weeks. 2 weeks. I mean, I get emotional really thinking about it, because that dude almost killed me, man. That dude almost killed me. When he came to the hospital to check on me, I let him have it. I let him have it. All the Brooklyn, Brownsville, East New York, all of it came out. I'm telling you, every last bit of it. I didn't care. It wasn't no professionalism at that point. I fired him that day. I waited until Dr. Kumar returned. And when she got back, she was highly upset. She was thoroughly upset, because I'm her patient, right? Why you coming messing up things with her patient, right? She didn't instruct you to do anything like that. Why would you be trying to test and mess with my patient? She was really, really upset. And she told me, she said, I will speak with him. I will speak with him. She apologized. She was so apologetic. And she said, Craig, I'm so sorry. I am so sorry. I apologize. Because it was her practice. It was hers and her business partner. This guy was under her. And so, that could have been drastic to her practice. I had to actually take insulin. Now, I'm not a diabetic now, but I had to take insulin for 3 to 4 months. I had to administer 2 different types of shots, the fast acting and then the long acting, however it goes. I had to do that for 3 to 4 months just to get my blood sugar levels back intact because of this guy. And so now we move to 2018. 2018 comes, and it was August. I remember it was summertime. It was August. And this one particular situation happened at home. It happened, right? In my neighborhood, rather. It was about maybe 5:30, 6 o'clock in the morning. My Ring doorbell is going bananas, right? And so, of course, you can view it on your phone. So I look at my phone and I can answer the door with my phone. So I see it's my neighbor's son, right? It's my neighbor's son. And I said, hey, Malcolm, what's up? What's going on? What you need, man? Everything all right? He was like, Mr. Craig, could you help me? My dad won't wake up. My mom told me to come get you. But my dad won't wake up. I said, all right, Mal, I'll be there in a minute. And so I jumped out of bed. And I'm like, what's going on? Early this morning, he won't wake up. What's up? So I jump out, I go next door. And so his wife is like, Craig, we can't get him up. Something's going on. So I go upstairs and I'm calling them. Paramedics come. Y'all, my neighbor done passed away. My neighbor done passed away. And I just can't get that out of my head. So you probably are saying, well, what does this have to do with your kidney and finding Dr. Kumar and all that other stuff, right? Yeah. So that that week, it's like, wow, I done been through this with my neighbor. You know, my neighbor done passed away. I feel bad. He had two small kids. Well, the other kid, he was a little older. The oldest one, I don't think he was in high school yet, but middle school. So you like, what's that got to do with it? But anyway, I'm like, I can't get that out of my head. You know, very traumatic for me. That my neighbor and in my neighborhood, you know, our neighbors were very, very close. And so, but I'm excited to go see Dr. Kumar, right? Go to see Auntie Kumar. I'm excited about that. I'm looking forward to it because I know I was doing what I was supposed to do, and I was looking forward to seeing my labs to see if anything improved or any, you know, what's going on. So I get to the office and they say, "What's your name?" And I think it's a new girl at the front. And I'm like, "I'm here to see Dr. Kumar, Craig Merritt, blah 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 blah." And she's like, "Okay, wait right here." And so my normal nurse, who I know, became very very close with. She comes to the front, and I'm joking with her. You know, my personality. I'm joking. I'm cracking jokes and everything. And so she says, "Mr. Merritt, you here to see Dr. Kumar?" And I'm like, "Yeah, you know who I'm here to see. Yeah, what's up? Blah blah blah." And she's hesitant, and she's looking at me with this blank stare. And she's like, "Oh, Mr. Merritt." And I'm like, her name was Tisha. I said, "Tisha, what's wrong? What happened?" She said, "Mr. Merritt, I'm so sorry that you didn't know." She said, "Dr. Kumar passed away earlier this month." I'm like, "What?" She said, "Yeah, Dr. Kumar passed away earlier this month." I tell you, they had to come and pick me up off the floor because I that was devastating. And when I think about it, I was boo-hooing. I know I was. I remember it vividly. They had to come from behind the thing, the door or whatever, and literally come pick a grown man up off the floor, sobbing. And they did a good job. They was consoling me. I am, it's like like your mama or something like that. She was a family member. And she passed away earlier that month. And the reason why I told you the story about my neighbor is because I had been that week. I went through experiencing that, and then now hearing this about your nephrologist, because I didn't see my primary care physician that much. I would just do yearly physicals, and I would see her all the time. And then to hear more bad news or sad news, whichever one you want to call it. Very devastating. It was sudden. They explained to me that she had a brain aneurysm. She was in her garden and had a brain aneurysm and died. Almost immediately. So I felt as though I lost 2 family members. Even though she passed away earlier that month, I had no idea about it. But I'm getting the news the same week. Very, very devastating. Now I am concerned. I did have reservations. Me and my family, we all had reservations. By this time, everybody in my family knew who Dr. Kumar was. Even my friends knew who Dr. Kumar was, right? They heard me talk. They used to hear me talk about her all the time. And so now what? Now who's going to do the job? Who's going to do the work? And so I have reservations. I have concerns now. Sure, there's other nephrologists within the practice. The only other person I knew of that was really good was her partner, Dr. Rahman. And so, but he's full to capacity. He can't take any more patients. And so Tisha, she's given me some recommendations. I go with one person. That doesn't work out too well. And I learned from the last time doing the reviews, taking a look at the reviews of this particular person, not good. And I saw why, because there was an incident that happened again, and that didn't work out with that particular person. And I go back to Letitia and I say, hey, Letitia, this person not working out. Who else you got? Who else you got? Because now, now I understand how it all works. And now I know I have rights. And now it's like, hey, I'm interviewing now. Hey, if you're not making the cut, you're not making the cut. You're not cutting it. Next, send the next person in. I'm interviewing, right? Because it's my life. My life. I'm not looking for another Dr. Kumar. However, I'm looking for someone who's going to do the right thing and do right by me, right? And so Letitia says this: why don't we just put you with Dr. Kumar? I'm like, yo, Letitia, stop playing. What you talking about? Listen, stop playing. She was like, no, Mr. Merritt, no. I'm trying to tell you, Dr. Kumar, her son. I was like, oh, word? Yeah, he's with us now. He done graduated, whatever. He's here. He's with us. I said, really? She was like, yeah. She said, give him a try and you let me know, right? I said, okay, let's do it. Let's go. I tell you what, this guy, and I'll say this. You know the saying, apples don't fall too far from the tree? I'm telling you. It was Auntie Uma Kumar reincarnated in her son. And the reason why I'm telling you this is because this guy, not only his approach to treating you was just like hers, but his spirit was just like hers. Even though he was more quiet, like like his demeanor was a lot different. He wasn't as bubbly as his mom was. Not to say he didn't smile, but he wasn't as bubbly as she was. However, his approach to the treatment was exactly the same. I don't know if they discussed all of the patients and how this one, I have no idea. But his approach and spirit was exactly the same like his mom. And all I could do was thank God. That's all I could do, was thank and praise God for providing for me that type of care. So again, thank you all for your love and support. Get in position.